All right, so when we're doing complex pulmonary valve interventions, it's very nice to see the relationship of the pulmonary artery with the coronaries and other adjacent structures like the aortic root. So we can see a very dilated MPA there, which is very nice to see. We see the rest of the anatomy really nicely. So that's um, quite useful. We can change the opacity of that model. So we go into our settings and we have it selected, the RV2PA. If we go to visuals, we can change the 3D opacity and make it completely like solid, or you can just keep the opacity. It's great. Because what I want to show you later, I'm gonna leave it like this, but also we can hide that structure and go to a volumetric rendering. It's going to show us like the actual anatomy of the heart with the volumetric as we have been doing in other demonstrations, which is a very quick segmentation. We can have our echo embedded into this 3D reconstruction. So I'm going to go here with my echo, which was done as an intracardiac echo after the case. So we can show that functioning valve inside the MPA, which we can do auto registration or manual registration. So we can see where the valve is there. This is the pre-intervention CT, and it's a very nice way to see the echoing there. So I'm gonna use my clip sphere to just to crop through and see that. So we can see the images from the eyes, through the eyes that we performed, and we can overlay it over the structures. And we can have a dynamic CT, which in this case is not dynamic CT, but we can have this dynamic echo where we can have the segmentation of the echo. Now, this structure is automatically rendered with a volumetric render with an option called echo. And we can change the characteristics of that as we do on the machines, that we can actually change the contrast or do the 3D reconstruction, but a little bit quicker using the same tools on the volumetric. So you can see the valve opening and closing in place. And that's a very nice thing to do for patients like with AAV canal and other patients that we have a 3D echo of the valves and we can overlay over the CT. So this is a complementary imaging for complex patient surgical planning.